going wrong for a while. As we grew over the years, we became disjointed, one office here, another there. So what we have attempted to do in the last couple of years is to solve that problem by exemplifying our motto of communicate, collaborate, and cooperate. And that means you need to have people close together so that they can communicate, collaborate, cooperate. Prosperity is based on proximity in many cases. So when we have our talented people in these various agencies working together, where they see each other, get to know each other, that amplifies their abilities and the perfection of their services. I believe we have the greatest people in the whole world in South Carolina. You know, I love to talk about our history and where we came from, how we got here and what we've done. But I can promise you this, right now, we are on the way up. We have people from all over the world wanting to be a part of the South Carolina story. Some of them want to live here, but others from other countries want to have our people doing their business, making their things, making their products, making their company stronger. And they invest hundreds of millions, even billions of dollars in this place. And we've been meeting with them just this morning. It is exciting to see the prospects of the future for South Carolina. But one thing we have to do to be sure that we can meet that challenge, to meet those opportunities, is to be sure that our people are strong. And that means we have to educate them, we have to keep them safe, and we have to keep them healthy. And that's what you're about. That's your job, that is your promise, and that is the promise of South Carolina to our people. So I want to thank everybody involved. These leaders you see standing here before you, and many others that are there, and many others around the state whose efforts and energies have led us to this point. This is a wonderful day for South Carolina, and it is a fact that this is the best place in the whole country to live, work, and raise a family. So we will talk about it just a little bit, and then we'll sign the bill, and then we'll celebrate a little. Mr. Chairman.
Thank you, Governor. Yes, sir. The 3 P's of a successful public servant is be present, be prepared, and be patient. There's that patient thing that's always been tough for me. But Senator from Lawrence, Senator Verdon, Chairman of the Medical Affairs Committee, that's when we started the journey on this issue, when I was Chairman of Medical Affairs. First of all, we turned it over to our quarterback. I call him our quarterback, the Senator from Beaufort, Senator Davis. He takes on issues like this and runs them across the goal line. And he did this on this issue also. And then on all issues like this, he's helped us. It started off with the certificate of need, needing to address it. The certificate of need process, to me, I think that's when the joke, we're with the government, you're here to help you, started. So we eliminated the certificate of need. Then we talked about the Beach 12, I call it a DHEC, we addressed that. And then today, what we're doing, the consolidations of these 3 agencies, working to restructure our government on health care. So it's a big day for us, big favor for here. It's important piece of legislation. And my opinion is, Governor, that this piece of legislation will make our citizens of South Carolina happier and healthier for generations. Thank you. Now, the President of the Senate, Senator Alexander, has been with us every step of the way.
Thank you, Mr. Chairman. Good afternoon. It is truly a great day to be here, to be a part of this today, and to get to this point. Mr. Chairman, as you said, that patience, I've seen you work on that, and it's paid off from the standpoint of us getting here today. And I think as you look at this behind us, this is Team South Carolina in its best because we're putting the people of South Carolina first. The needs of the people. Again, great team effort from Chairman Burden, as the chairman talked about, our quarterback, Senator Davis. Governor, thank you for your leadership. You're not only on this issue, but all that you do for South Carolina of making sure that we are on track for a great future, and to our House colleagues. But as I reflect on this, and you think about these agencies that are represented in this bill that's being ceremonial signed today and what it represents, having been involved in the subcommittee of healthcare and the finance committee, and hearing from constituents, not only in Senate District Number 1, that I have the great honor to represent, but for hearing from citizens around this state, I think what this symbolizes when we are bringing government together, restructuring, but we're also providing the opportunity to meet people where their needs are. When you think about mental health, DAODIS, DDSN, so many of the individuals that need care by one of those agencies needs care by another agency. And we've kind of had that silo system here in South Carolina. And if you will, I like to refer to it as kind of being ping-ponged from one agency to the other. This gives us the foundation to make sure that the needs of those individuals that are reaching out for help are going to get the help that they need by having that coordination and communication and cooperation. I think I finally got your 3 C's. I've been working on it a while, about several years now. But it represents the very best from that standpoint. But it really has to drill down, in my opinion, to making sure that those services are also coordinated back in our communities. And that's the challenge that this new agency and these that are a part of that will have, because that's where the rubber meets the road. But I'm confident with the right leadership and organization at the top, our citizens across South Carolina are the real winners today to be that healthier and happy citizens across South Carolina, from the upstate to the Midlands to the coast of this great state of South Carolina. I'm honored to stand with these leaders back here to be a part of this today as we celebrate it. And at this time, I have the great pleasure of introducing and bringing to the podium the quarterback, as the chairman called, but also the chairman of the Labor, Commerce, and Industry Committee, but all in the Senate, but also does so much in so many different realms for us, Senator from Beaufort, Senator Tom Davis. Thank you, Mr. Chairman. Thank you.
One number I want to start out with, 32. The reason that number is important is because the first major restructuring bill that happened in South Carolina was in 1993, when Carroll Campbell signed into law creating the first cabinet in South Carolina. Prior to that, we were the quintessential legislative state. You've heard South Carolina being called the legislative state. Well, what does that mean? Well, it means that we have a legislature pursuant to the 1895 Constitution that makes the laws, through electing judges, has a material say in interpreting the laws, and up until 1993, all through today, it had a hand in executing the laws through agencies that were by and large controlled and appointed by the legislature, not the governor, not a cabinet. And so we're all familiar in grade school about checks and balances and the 3 branches of government and how that's a healthy form of government. They check and balance each other. We didn't have that here in South Carolina. In 1993, before 1993, when Governor Campbell signed in the first major restructuring bill, there were 77 different state agencies that provided services. That bill collapsed them down to 17 agencies and put a lot of them under the control of the governor, which is where executing the laws should be, right, in the executive branch. But one thing that Carroll Campbell could not accomplish was getting the healthcare agencies within firmly that executive branch of government. You still had DHEC, which was a commission structure, which was not accountable to the governor. You had Department of Disabilities and Special Needs, a commission agency, not accountable to the governor. You had Department of Mental Health, similarly, a commission agency, not accountable to the governor. And so for years, and what got me involved in politics was trying to bring in, when I was working for Governor Sanford, we talked about how can we have those proper functions of government in the executive branch brought within the executive branch. And Robbie Kerr, actually, this is coming full circle. Robbie Kerr was Health and Human Services Director when Governor Sanford was in his first term, when I was Chief of Staff. So I've known Robbie for that long, and we've been talking about doing something like this today for that long. And the reason this is happening, the reason you now have all the healthcare delivery agencies in the executive branch, in a cabinet accountable to the governor, is partly because of the leadership of Governor McMaster laying down the marker and saying we need to accomplish this for the people of South Carolina. But most importantly, if you look at this bill, the primary sponsors are Harvey Peeler, the senator from Cherokee, and Thomas Alexander, the senator from Oconee. That is extraordinary that the two most powerful members of the Senate, the leadership in the Senate, was willing to surrender, quote unquote, executive powers fully into the executive branch. That's a degree of leadership and cooperation that I had not seen in my 20 years involved in politics. But that's how something fundamental like this can occur, is when you have leadership like that and people put the health of our republic here in South Carolina at the forefront and not institutional jealousies. So I want to thank Governor McMaster. I want to thank Chairman Peeler. I want to thank President Alexander, and also my good friend Danny Verdon, Chairman of Medical Affairs. I mean, Senator Peeler, you pointed to this. A lot of heavy lifting has been done in that agency under his leadership. We got rid of CON, this idea that the government has to control where hospitals are built, and hospitals have to come get a government permission slip before they can provide health care. We beat that back and repealed CON. We took DHEC, and it was often said that you're never going to divide that up, and divided it into the two excellent cabinet agencies, DPH and Department of Environmental Services. This was the last piece, getting these three relatively small but very important state agencies, DDSN, DEODIS, and DMH, coordinated. They serve overlapping populations. People with alcohol problems often have mental issues. People with mental issues also may have disabilities. So you have these overlapping populations, and yet, because of that 1993 incomplete restructuring, we still had them operating independently. Today, I think we can declare restructuring complete. Today, 32 years later, we are accomplishing what Carol Campbell tried to accomplish and could not. And we did so with the leadership of the people you see behind me. And as Senator Alexander said, President Alexander said, this is all about better services for South Carolinians at a lower cost. All of you great professionals now will work collegially with the same information systems, working with caseworkers that overlap. It's a great day for South Carolina, and I'm very proud to be a part of it. Thank you.
Good afternoon. Can everybody hear me okay? Good afternoon. I want to tell you that I appreciate being here. It is an important day, and it's an important day to me. I've spent 9 years in the House of Representatives, and only in the last few years have I really felt like, wow, we're getting things done. I appreciate Senator Davis's work on this bill and many others. His group works with the mirror group on the House side. I want to also appreciate and have a shout out for the folks in the House of Representatives. There is a House and a Senate, by the way. I want to make sure y'all remember that. So we all worked very hard together. We're here not to do the easy things, but we're here to do the hard things. I have a statement that's prepared. I just wanted to make sure that I said certain things. So I'm particularly excited to be here for this bill signing. This signing is not just policy. It's about compassion, responsibility, and a deep commitment to the well-being of South Carolinians. This is more than just a structural change. It is a promise to the people who have struggled to navigate a confusing system while in crisis, a promise to families who've spent years searching for help, that should have been simple to find, and a promise to healthcare providers who need strong, unified partners in government to serve patients with care and effectiveness. For too long, mental health services have been spread across multiple entities, potentially resulting in confusion, delays in care, and opportunities missed to intervene and to heal. With this bill, we are changing that. We are creating one integrated responsive system, a system that speaks with one voice and that will streamline care pathways, reduce bureaucratic hurdles, and prioritize outcomes over paperwork. We've even added an accountability requirement that ensures we are maximizing efficiency, consolidating duplicative programs, and eliminating redundancy, while ensuring that the quality, accessibility, and specialization of services are enhanced. Most importantly, we are putting patients and families at the center of our mental health and healthcare strategy. We know that the work doesn't end here. Implementation begins now, and we will do it with transparency, accountability, and urgency, because every day is a missed opportunity to help someone in need. Thank you.
Well, good afternoon, and what a pleasure it is to be here. And Governor, thank you for allowing me to come out of my retirement to enjoy this time. I was within inches of wearing board shorts and a T-shirt here, but I thought that might be too much for y'all. So, and Chairman Peeler and Chairman Alexander, yes, patience is the right word. 20-plus years, and I know this has been a priority of yours, and I'm glad to see it here today. When I was in the state, I used to be asked frequently, what are the major challenges that we have in South Carolina, particularly when it comes to health? And of course, that can be a long list, as we all know. But the answer is really easy. The challenge is we have no plan. We have no vision for health in this state. And the reason we don't have a vision for health at the time is because our agencies were in their own silos, disjointed, not serving everyone as they should be. That ends today. One of the more discouraging things I would encounter, as Senator Davis referenced, we'd have dual diagnosed individuals, people who might have mental health problems, people who may have addiction problems, people who may have intellectual disabilities, who duly diagnosed but couldn't get services at our agencies because the agency's bureaucracy would get in the way. Because we knew what we were supposed to do as mental health, or we might know what we were supposed to do at DDSN, but we didn't know what to do when someone showed up that needed both services. And families and children suffer. To this day, I think there are 12,000 duly diagnosed individuals in this state now. And again, as I said, that ends today. So I'm proud to be here. It's been said that the worth of a state is determined by how well it values its citizens. And I believe that. And today we show that we value these citizens and we value the people who have behavioral health, intellectual disabilities, and addiction issues more than we have in the past. So I'm looking for great things out of here. The one thing I know that is true is that the employees that work at these agencies are the best in the world. These employees know what they need to do. All we need to do is point you in the right direction and get out of your way. With that, thank you very much for letting me be a part of this.
Well, ladies and gentlemen, thank you everybody for coming. Thank you for the work that you've done, the work that you're going to do. And it's clear that it is a remarkable day when the goodness of the government approaches the greatness of its people. And this is such a day. Now we'll sign the bill. Anyone have a question for anyone? That's about the easiest question I think I've heard. It's so easy, I'm going to get Tom Davis to answer it for me.
It's true that last year, on the last day of session, that particular bill, S-915, fell short. We ran out of time. In addition to the 3 agencies we have here, it also included HHS, Department of Public Health, and I believe Aging may have been there as well. So it was a much larger organization. I think you can argue in favor of more efficiencies if all of them had been in one entity. I don't think it's as critical that HHS be a part of it, because that's essentially a payor, a Medicaid payor agency. But when you boil it down, and if you look at the report that we had done, the year-long report that served as the blueprint for this, the one thing that came up over and over again, and they stressed above all else, is that DDSN, DMH, and DOTIS had overlapping populations, and if you do nothing else, take care of this. And so government is all about the good, not the perfect. And so we were at a time where there were concerns about too much power being controlled or brought into one agency. I frankly think those concerns were misplaced, because the concerns are you need to have somebody accountable to that agency, and we were bringing accountability to it. But the legislative process is one of compromise, and the legislative process is one of listening to the concerns of others. And so we regrouped after that failure last year and came back and got, I think, maybe 90% of the loaf. And so I think it's an excellent step forward. In the future, there may be an opportunity to revisit if there's overlaps with DPH or with HHS. But I think the main thing is every single agency that delivers healthcare services now is in the cabinet and directly accountable to the governor. So whatever efficiencies and whatever cooperation and whatever coordination that the governor wants to have happen, he has that authority now that they are all in his cabinet. That's a perfect segue back to the governor.
We'd like to have someone like Robbie Kerr, who's the best, the best there is in what he does. All in favor? Robbie? Forget about the vacation, son. We were looking for the very best people, and fortunately, as we've seen with business invitees and those who want to come here, people have discovered South Carolina, and it's all not only because of the physical environment and all of that we have, but it's because of the people. So with being such an attractive place with such attractive people, we're looking for the very best. Sooner the better. But we want to, we're looking for quality and not speed. But it's an important agency, so we have to get moving. We'd like to have a track record, like to have a good educational background, like to have experience in all the various areas that may come up in that particular agency, like someone that has a broad view of how all the agencies fit together, because that's what we're doing here. And there are people like that. There's some in South Carolina, and there are others that like to be in South Carolina. Next. Anybody got something else we left out you want to say? In that case, thank you very much. I want to thank all of you who work under this roof and other such roofs around our state. We all have an opportunity to help out people when they need a little bit of help. We have an opportunity to help them. Everybody doesn't get that opportunity. So thank you, and thank all these leaders for being here today.